Good morning, I'm Cari-an. I'm a second year medical student in Swofenma. Can I have your name and age, please?
Randy, 36.
Okay, Sir Randy. So I will be doing a head and neck examination for you today. Is that okay with you? And now for the eye exam. So examination of the visual field is to detect any dysfunction to central or peripheral vision may be caused by various medical conditions such as glaucoma, brain tumor, stroke, or any neurological defects. So one of the tests is the confrontation test. So first, I will be doing the static wiggle finger test. So now I will be positioning myself one arm away from my patient, and then ask my patient to cover his eye. Yes, sir, please cover. And I will cover also the opposite eye. Can you stare at my open eye, please? And please tell me if you see my finger wiggling on the side. So I will be positioning my finger 2 feet apart from my patient. It is also to test if my patient has good peripheral vision.
Yep.
Yes. Other side.
Yep.
And now I will be doing the inspection for conjunctiva and sclera. So I will be asking my patient to look up while depressing his lower lids in order to check for any color. And then I would inspect the sclera and on the palpebral conjunctiva for any color changes. And note any vascular patterns also in the white scleral background. And also I will also look for any nodules or swelling. Sir, can you remove your glasses, please? Can you look up? So, press it and see. Okay. So now I will be doing the 6 cardinal directions of gaze. So this is an assessment for extraocular muscles and also for the innervation, okay, of the eye. So sir, can you follow through when I move the pen? Okay, just look at the tip of the pen. Okay. Okay. So when you're doing that, you should note for any shaking or nystagmus whenever you move the pen upward or on the lateral side. And now I will be going to do the corneal light reflex exam or the Hershberg test, which is an assessment that is particular or useful in order to test for strabismus or misalignment of the eye. So in this exam, I will be using this pen light and instruct my patient to focus their gaze on the light source. So in a distance of 2 feet, shine your light source equally into the patient's eye at the midline. So if there's normal alignment, the reflection will appear in the same position in each pupil. So now I will be doing the assessment of the pupillary reflex. So it is an assessment in order to check. So for the light reaction, there's 2 types: direct reaction and consensual reaction. I would ask my patient to look into the distance, and then I would shine light obliquely into each of the pupil and would see constrictions. In the direct reaction, there's a pupillary constriction in the same eye, while in the consensual reaction, there's pupillary constriction on the opposite eye. So now I will be positioning my patient so I can see comfortably from the otoscope. And then, in order for me to see clearly on what's inside the ear canal, to straighten the ear canal, I should pull the auricle firmly, upward, backward, and slightly away from the head. Sir, I will be inserting the otoscope. So now I will be doing the whispered voice test, in which I will be standing feet away behind from my patient and occlude his non-test ear, and I will whisper to him a combination of numbers of letters and see if he actually hears me. So sir, I will be whispering combinations of letters and numbers, so you will tell me what did I whisper it to you? Okay. I will have a full breath first and occlude the other ear.
A, B, C.
Other ear.
K, L, M.
Okay, again, other one.
X, Y, Z.
Okay. So now I will be doing the tuning fork test. So this is a tuning fork, and for this test, I must ensure that the room is quiet and use a tuning fork with a 512 Hertz. So I must set the fork into a light vibration by tapping the fork into my forearm, the front of my elbow, like this. Now I will be doing the Weber test by using this tuning fork. So I will vibrate the fork and place it at the top of the head of my patient. Sir, can you tell me on which side did you hear the sound when I place the fork on the top of your head? Okay.
Both.
Okay, again. Okay. Normally, patient would hear the sound at the middle or on the both sides of the ears, but in cases of hearing loss, the patient can only hear on one lateral side of the ear because the other one is already impaired. So now I will be doing the rings test. For this one, I will be placing the lightly vibrated tuning fork at the mastoid bone of the patient and ask him if he no longer hears the vibration. And after that, I will place the tuning fork near the ear canal and ask him if he hears any vibration. Okay, sir, please tell me if after I put the tuning fork at the back of your ear, if you don't hear any vibrations. Okay. More. I'm still here. Now I will be inspecting the inside of the nares. So I will be inspecting the nasal mucosa and nasal septum. For nasal mucosa, I will be noting the color, any swelling or bleeding, or presence of exudates. So normally, the nasal mucosa is redder than the oral mucosa. And for nasal septum, I should note the presence of perforation, inflammation, and deviation of the nasal septum. So in this exam, I will again be using an otoscope, and I would be slightly tilting the head of my patient in order to see clearly on what's inside the nares. Sir, can you move? And again on the other side. So it seems normal. Next one is to palpate for sinus tenderness. So I will be palpating the frontal sinus, which is actually located under the bone of the brows, and the maxillary sinus. Sir, I will be palpating for sinus tenderness. Can you remove your eyeglasses first? So pressing here. Any pain or tenderness? No. Okay. So for inspection of oral mucosa, the materials that we need is a tongue blade or a tongue depressor and a good lighting. So this is to assess if there's presence of redness, swelling, or exudates or any ulceration in the part of the oral mucosa, in the gums, or in the palate. And also I will check near the uvula and if there's presence of inflammation of tonsils. Can you open your mouth, sir? Ah. To palpate any tender lesions in the oral cavity, so I will be using gloves and gauze. So this one, I will use my gloved right hand first to grasp the tip of the tongue into the left side of the patient and use my left gloved hand to palpate any nodules or lesions and inspect also for the any feeling of induration. Sir, can you open your mouth and protrude your tongue out? Okay. So I will be grasping the tip of your tongue. Okay. I will do it in the other side. Sir, can you protrude your tongue again? So there's no any lesions or nodules present. And now I'm going to palpate the lymph nodes. So I will be using my middle and my index finger to palpate. So first I will going to palpate the pre-auricular nodes, the posterior auricular nodes, the occipital nodes, the tonsillar nodes, the submandibular nodes, the submental node, the superficial cervical node, the posterior cervical nodes, the deep cervical chain, and the supraclavicular nodes. And for my findings, my patient is Rondy Bacolod, 36 years old. For the eyes, and for the inspection of sclera and conjunctiva, so the sclera is white and the conjunctiva is pink. Pupils are 4 millimeters, constricting to 2 millimeters in light reaction test. It is equally round and reactive to light, and it accommodates fine. These margins are sharp. There's no hemorrhage or exudates, no arterial narrowing. For the ears, the acuity is good for the whispered voice test. Tympanic membranes with good cone of light with my instrument otoscope. And for Weber midline tuning fork test, AC is greater than BC. And for the nose, nasal mucosa is pink. The septum is at the midline, no sinus tenderness. And for the mouth, the oral mucosa is pink, dentition is good, and the pharynx is without exudate. And for the neck, the trachea is at midline, which is normal. The neck is supple, and there's no any palpable tender nodes